The NHS was first set up in 1948. Now, 70 years later, people are living longer, often with complicated health conditions. So it's no surprise that this health and social care system is currently under huge pressure. We're having to make some major changes in the way it's structured and managed to keep up with high demand. In 2014, following many national reviews and reports, NHS England published the 5-year forward view. This describes how they believe health services need to change. All NHS organisations were also encouraged to work more in partnership with other public, private and voluntary sector organisations, either at a local, regional or national level, to improve quality and become more safe and efficient, give more accessible health and social care services, and to improve overall patient experience. Salford Clinical Commissioning Group, or CCG, is an NHS organisation made up of local GPs and other healthcare colleagues. They decide how to spend the NHS budget on health services for the city. This includes the care and treatment you receive if you go into hospital, mental health services, prescription medicines, and community health services. This film will explain more about the key developments in health and social care the CCG is involved in. 1. The locality plan. 2. The integrated care programme. 3. The North West sector. 4. Greater Manchester Health and Social Care Partnership. And explain how they all fit together to create a more effective health and care service that meets the needs of today's people of Salford. One of the biggest pieces of joint work the CCG are involved in is the Salford Locality Plan, known to the public as our Start Well, Live Well, Age Well plan. This plan was signed off in 2016. It sets out how the public and private sector organisations across the city will work together, enabling Salford to become a happier, healthier city. The Locality Plan aims to help the general population make changes in behaviour to become healthier, hopefully preventing them from becoming ill and needing to use health services in the future. Another citywide partnership programme that the CCG is involved in is our integrated care programme, known to the public as Salford Together. Working more closely together to improve services and models of care that will result in a more joined up delivery of health and social care system across the city. The CCG and the Council now share a budget for this, so we can use money flexibly across the health and social care for the best for patients, owning the problems across the system together and finding solutions together. In 2016, Salford Together's biggest achievement was the launch of our Integrated Care Organisation, or ICO. The ICO has enabled adult social care and health staff, district nurses, social workers, hospital staff and mental health professionals to come together and be employed by one single organisation, creating a more streamlined service for patients. Also, under the umbrella of Salford Together, all GP practices within the city have agreed to work more closely with one another and have created their own new organisation, Salford Primary Care Together. By delivering care for patients in partnership with each other, and by sharing additional skilled staff such as nurses, pharmacists and physiotherapists, we will reduce the pressure on our city's GPs and practices can improve care for their patients. The North West Sector Partnership is all about NHS organisations in Bolton, Salford and Wigan coming together to provide areas of speciality and to make sure that care is the safest it can be. The aim of the partnership is to deliver high quality hospital care to people in Bolton, Salford and Wigan, so it's sustainable, standardised, available around the clock, 7 days a week and as local as possible. We plan to make the northwest corner of Greater Manchester a great place for our clinical and supporting staff to work and train, so we get the best people and we know happy staff deliver better patient care. In April 2016, the government allowed Greater Manchester to take charge of its own health and social care budget. This process was called devolution, Now devolution has happened, it's the Greater Manchester Health and Social Care Partnership, and not Westminster, which decides how to spend the £6 billion we get every year to provide health and social care services across the region. The partnership is made up of 37 organisations from the NHS and councils, plus representatives from primary care and public health, NHS England, the community and voluntary sectors, Health Watch, the police and the fire and rescue service. All with the aim of delivering the greatest and fastest possible improvement to the health and well-being of the 240,000 people across Salford.
Audio Jungle.